Today, we are diving into a topic that is often misunderstood but critically important, especially if you're preparing for pregnancy or navigating hormonal health: MTHFR and methylation. If you've ever heard someone say, I have the MTHFR mutation, and wondered what that means, or if you've struggled with fatigue, miscarriages, anxiety, or hormonal imbalance and can't seem to get clear answers, this episode is for you. We'll break down what the MTHFR gene does, how to test for it, and most importantly, how to support your body holistically if you have this common variant. What is MTHFR and why does this matter anyway? So, MTHFR stands for methylene tetrahydrofolate reductase. A mouthful, I know. I had to practice that one a few times before I hit record today. But this gene plays a crucial role in a process called methylation, which is how your body detoxifies harmful substances, processes folate into a usable form, which is methylfolate, supports hormone production, makes neurotransmitters like serotonin and dopamine, and helps with DNA repair and cellular function. Some pretty important stuff, right? Again, that's all what occurs via methylation within our body. So, if you have a variant in the MTHFR gene, this process may not function optimally, which can lead to decreased ability to convert folic acid into active methylfolate, impaired detox pathways, especially estrogen and histamine clearance, higher risk of blood clotting or miscarriage, fatigue, anxiety, mood swings, or brain fog, and then poor hormone balance, especially in preconception and pregnancy. Now, the most common variants are C677T and A1298C. You can inherit one or two copies, which affects the severity. Now, how do you know if you have it? The only way to truly know if you have the MTHFR gene variant is through genetic testing. So, here are a few ways to find out. You can get a functional lab panel like a Dutch test or Genova, which includes methylation or detox markers. You could also do 23andMe or Ancestry DNA, which gives you raw data that can be uploaded to sites like Genetic Genie or Found My Fitness, or you could bring it to your provider and they could look through those numbers with you, those results with you. LabCorp or Quest, some doctors can order direct testing for these gene mutations, these variants, to see if you have it. And these typically are done out of network via insurance, outside of insurance, with a cash pay rate through things like LabCorp or Quest. Now, symptoms alone aren't diagnostic, but if you have experienced multiple pregnancy losses or recurrent miscarriage, severe PMS or PMDD, premenstrual dysphoric disorder, if you have a histamine intolerance, think allergens, migraines, hives, if you have a family history of heart disease or clotting, if you have mood issues that haven't responded to traditional treatments, it may be worth investigating this. And I have had a number of patients who sought testing on their own. They had experienced recurrent miscarriages, and this was prior to us working together, but they themselves sought out testing through, for example, 23andMe, and found they had this genetic variation of the MTHFR and we're not able to correctly methylate folate. And the interesting thing is that these individuals are often given specific prenatals that are prescribed by their OBGYN that have folic acid in it. Now, folic acid is a synthetic derivative of folate, and it is what is most commonly used in off-the-shelf prenatals and in prescribed prenatals. So if you get a prescription for a prenatal from your physician's office, look at it. It doesn't mean that it is an optimal form. And what I have found recurrently with patients when they come to me and say, well, this is what my doctor prescribed, and we look at it and it has folic acid in it, and their doctor did not even test to see if they have that MTHFR gene mutation where their body is actually not able to methylate folic acid. So this is extremely important. What I recommend across the board is to get a prenatal that has folate in it or methylated folate, because that's the form our body can use. Now, folic acid, again, that's a synthetic derivative and it is cheaper to make, and that is why it is more commonly used in prenatals across the board. So, something very important to look at, honestly, whether you have the gene or not, whether you're going to test or not, but certainly if you have tested and you know that you have this genetic variation, you absolutely need to avoid folic acid. And it's not just in prenatals, right? If we look at a box of cereal off the shelf in a grocery store, most are fortified with folic acid. It is in off the shelf breads at our store, in crackers. Anything they can add it into, they are. And so that is why I like to make our own bread. I search for cereals that do not have folic acid put into it, because I don't know how my kids' bodies are able to methylate or break down different things, right? I would much rather have just pure whole ingredients versus synthetic derivatives. So big picture point of mind for you across the board to try to avoid that folic acid that is put into so many things. Now, the good news here is that you are not broken. If you have the MTHFR variant, you just may need some more intentional support for your methylation pathways. So, methylation, again, we want to support folate, but not with folic acid. So, we want to avoid synthetic folic acid, especially in conventional prenatals and fortified foods. We want to use methylated folate. You might see it listed as 5-MTHF or folinic acid in supplements. Okay. Now, there are so many derivatives of this, but if you see methylated folate or methyl folate in your vitamin, you're good to go. What you'll often see is it will say folate and it'll say a number, and then in parentheses, it'll have an amount that is as folic acid. That we want to avoid, because that means a percentage of what they're saying your overall folate intake is actually the synthetic folic acid that many women cannot actually break down and use within their bodies. Now, we can also get natural folate from our food. So think dark leafy greens, lentils, asparagus, avocados, and liver. If you've been tuning into the show, you know that I am a big fan of liver. Now, if you are getting your grass-fed beef straight from the cow, straight from a farmer, and you are having it butchered and you're able to request to have the heart and the liver, the different beef organs ground into your ground beef, that is a great way to have it pre-packaged for you. And then you have some of those super good nutrients within your ground beef already. You can also get ground beef with organ meats ground into it at the grocery store. A good brand at Whole Foods is Force of Nature. So Force of Nature you can get at your grocery store, and they have liver, heart ground into that ground beef for you, and you cannot even taste it. Now, if the thought of consuming liver in its raw form worries you, or you just have difficulty accessing that, I love keeping desiccated beef liver supplements on hand. So this has great B vitamins in it and naturally occurring folate, and it's shelf stable. So if I am not cooking with beef liver that week, then I am being sure to take beef liver, desiccated beef liver supplements 3 to 4 days a week to mimic getting that in my diet naturally. Now, we also want to watch your B vitamins. So, MTHFR variants often impair B12 and B6 utilization. Now, these are very important vitamins for use in our body. And so, we want to consider a high quality methylated B complex with B12 in the methylcobalamin form. So, when you have this genetic variation, very important to chat with your doctor or functional medicine provider about the vitamins and supplements that you are taking and being sure they're in the optimal form for you. Now, again, we can get this from our food sources, so it doesn't all have to be from popping pills or taking vitamins or supplements. A food first philosophy is always Perfect. So we want to get pastured eggs, so eggs from chickens that are having access to pasture, to open field, and that are not contained in those high turnover farms where they're just packed in and having zero sunlight, zero fresh air, zero access to grass. So pasture raised eggs or free range eggs. We want wild caught fish, not necessarily farm raised. We want the organ meats. Again, they're a great source of that B vitamin. So that would be your liver, your heart, and then nutritional yeast. So this is something I like to add in when I'm cooking. It can give almost a cheddar flavor to it, a bit of a cheesy flavor. So nutritional yeast is a nice thing to have in your pantry cabinet, and you can just top on different dishes and it gives it a cheesy kind of texture. Now, we also want to reduce your toxin load. So methylation helps with detoxification. So give your body fewer toxins to process. If you go back to episode 4, you will learn healthy hormone swaps for your home and everyday detox for everyday women. And so that is a really good episode to learn how to not only reduce your toxin input, but also to optimize your output. So methylation helps with detoxification. Again, these methylation pathways are impaired if we have that MTHFR genetic mutation. So we need to give the body fewer toxins to process. Now, we can do this as a quick hitter with filtered water, non-toxic cleaning supplies, non-toxic beauty products, and then minimize our exposure to plastics. So swapping out any of your food packaging for glass, being sure you're cooking with stainless steel or non-toxic ceramic, glassware in the kitchen so that we are minimizing our exposure to these toxins. Now, again, I go into much further detail in this on episode 4. So go back and listen to that if you have not already. Now, supporting our detox pathways, this looks like increasing our ability to sweat. So whether that's in the sauna or through regular exercise, getting regular lymphatic movement. So that could be from walking after each meal or rebounding, which is hopping in place for 10 to 15 minutes, or using a dry brush to help stimulate those lymphatic pathways. Supporting their detox pathways also involves bowel regularity. So that means having a bowel movement every single day. That's going to help eliminate those toxins from our body so they're not just sitting there and getting reabsorbed. And then, of course, hydration. That's going to help us pee out any extra waste from the body. We also want to support the nervous system. So, methylation impacts neurotransmitter balance. This can lead to anxiety, panic attacks, irritability if that methylation is not in balance. So, prioritizing nervous system regulation through breath work, use of supplements such as magnesium or adaptogens like ashwagandha, and ensuring you're getting enough sleep. If you need assistance for that nervous system regulation piece, I touch on that at length in episode 5, the nervous system fertility connection that nobody talks about. That would be also a great episode for you to go back and reference. Now, finally, the nourishment of the gut and liver function is really important for supporting those methylation pathways holistically. A sluggish liver or a compromised gut leads to lower clearance of excess hormones and toxins. So, eating things like cruciferous vegetables, having lemon water. I love warm lemon water, warm water with a squeeze of lemon juice and even a pinch of sea salt in it for some electrolytes. It's a great way to start your day and gently stimulate the gut. Gentle movement, so things like mindful movement paired with your breath. So think Pilates or yoga based movements or even bar where we are getting good mobility paired with some stability and breath work. That is also going to really help with that gut and liver function. Ensuring you're getting enough fiber-rich meals. So I have an upcoming guest where we dive into fiber at greater length. She is Ginny of the Women's Health RN, and she's coming up in a future episode, but we dive deeper into fiber and its importance for the gut. And so that is also very important here in terms of methylation, particularly if you have that MTHFR gene mutation. So fiber-rich meals, making that a priority. And then castor oil packs. So this is something that Clinically, patients see a lot of good results with. However, the research is not really there to support it from a cut and dry standpoint. But this is one of those things that I say let's look at risk reward. So if the risk is very low, you're applying some castor oil to a pouch essentially that you're putting against your liver and you're letting it sit there. If you feel better after using it, fantastic. If not, and you're like, I don't notice a difference, then maybe it's not for you. But it's one of those things that has such low risk that it's like, why not try it and see if we can support that liver function for you? Moving into MTHFR and pregnancy and preconception. So, this is where MTHFR gets a lot of attention, and rightly so. Now, if you're trying to conceive or pregnant, ask for a methylated prenatal that avoids folic acid. And we talked about this. And again, I just recommend across the board nobody needs a synthetic form of folic acid. Let's just go straight to that methylated folate. I will link in the show notes my preferred methylated folate vitamin. It is by Folwell prenatal, and they just have optimal forms of nutrients across the board, inclusive of choline and a number of other vitamins that are often not utilized in many prenatals across the board. So, Folwell is a great one that uses a methylated form. Seeking Health and then Needed are also other brands that do so. We want to support your detox and nervous system balance from the start. So, particularly if you are trying to conceive, we want to support those detox pathways before we have a baby in utero, right? We don't want to be focusing on a ton of detox when we're growing new life. And if we think about mobilizing toxins in the body, getting it into the bloodstream, getting it into circulation, we don't want to move any of those toxins towards baby. So having ourselves nice and detox from the start and a balanced nervous system is going to keep you feeling good in pregnancy, but also lead to a healthier baby who is not having to battle any kind of toxin load alongside of you as you move through early pregnancy. And then certainly consider working with a functional provider to monitor homocysteine levels, clotting risk, and nutrient status. So again, these would come from labs where we can look at your micronutrient status ahead of conceiving. We can look at any kind of clotting factors because that can sometimes be a factor in recurrent miscarriage. So knowing that sometimes these things can go hand in hand. If we have an MTHFR variant, ensuring that we can rule out other predispositions that may make it challenging to conceive or carry that pregnancy to term. Now, a common myth is that if you have the MTHFR variant, that pregnancy will automatically be difficult. But the truth is, when supported properly, most women go on to have healthy, thriving pregnancies. So I want you to hear that again. If you have the MTHFR variant, when your body is supported properly from the start, most women go on to have healthy, thriving pregnancies. Okay. So just because you have this variation does not mean that you are going to struggle to conceive. It does not mean that you are going to struggle to carry that baby to term, but it does mean that you have to take into consideration extra factors that somebody who does not have this variation, it may not affect their body or their pregnancy as much, right? So having the MTHFR variant does not define you. It just means that your body has unique needs. When you understand how to support your methylation pathways, you can feel clearer, calmer, and more in control of your fertility and overall health. If this episode resonated with you, I highly recommend checking out the Holistically Well Preconception program. This is where I cover topics like methylation, nutrient timing, micronutrients in the body, detox support, and more in-depth understanding of tracking your cycle, fertile windows, and exercising to support fertility. And if you're not sure what kind of prenatal is right for you, remember to check the show notes that has that Folwell prenatal that I recommended, which uses that methylated form of folate. Thank you so much for tuning in. And if you found this episode helpful, share it with a friend or leave a review to help more women find this support. Until next time, be well and keep trusting what you can do to support your body for the better.